Hi y'all, I'm Jonathan and I'm going to share and present my mission, vision, and values paper, Effective Communication and Working Relationships. Each day as a clinical nurse is a dynamic and rewarding experience. With that being said, that does not mean each day is devoid of anxiety and hysteria. My mission brings patient and family-centered care to the forefront and is appropriate to my hospital's vision. My current mission as a nurse and future leader includes advocacy, autonomy, collaboration, use of evidence-based practice, and professional development. While all go hand in hand, I've decided to discuss the importance of collaboration as effective communication integral to working relationships. Whether being unsure of who I will be working with or collaborating with, how many patients I will have, or if I will have to undertake being in charge of the unit, I always take it into account and in my own hands to succeed in providing the best of care while communicating efficiently and effectively with collaborators. My personal ethics are dynamic, yet connected with a good set of roots in beneficence and non-maleficence, as well as justice. I believe that being virtuous, truthful, diligent, honest, respectful, and modest define my moral character. In other words, I have integrity. I believe in myself and in others, but know that humans all have different views on what makes something ethical. I devote myself gladly to said collaborations, and with an open heart constantly. I do pay the price in deriving a good amount of my happiness on that achievement. I know I must advocate for my patients in ways that I would will others to do for me. But I also know that I must do this within the scope of my own practice, hospital policy, system policy, and even that of my state board. Managing situations that break the barriers of my personal ethics is what I always enjoy reveling in. That's what makes nursing challenging and forever engaging. Woo! As I comprehend it, ethics is the art and science of achieving the ideal human character. I know that that's kind of impossible, but I enjoy making myself exhausted trying. The backbone of our collaboration in an acute care hospital and setting, especially in surgical step-down, is patient and family-centered care, which rings true in all aspects of the day. We must ethically provide for and determine the impact of our collaboration and what it has on our patients and their outcomes from the moment they are admitted up to the time of discharge, which includes post-discharge from the hospital. According to Huber, page 57, 2014, the importance of creating an environment with a culture and climate that empowers nurses to practice in ways that support a positive practice environment can maximize nurse and patient outcomes. We must not forget how important that collaboration is as nurses. We aim to effectively learn to respect and honor our patients' wishes, communicate their needs to others, all while following providers' orders, providing social, moral, spiritual support, especially as it pertains to working with social workers, case management, and pastoral care. This does not occur without promoting positive interprofessional relationships, which is no easy task and takes time to master. I've become slightly proficient. Nurse collaboration begins with our patients and extends to every aspect of the hospital, whether it be communicating with other nurses, providers, nursing management, case management, social work, environmental, engineering, materials, other units, the emergency department, PACU. We are in a constant state of flux, not really knowing where our day will begin and end, giving everything we have to patients we most likely have never met before. This is courageous and exciting and draws from the senses. The heart, the mind, what the soul screams. It reminds us that we are human, that we are fallible, but that we can always strive to do better and enhance humanity in the process. I believe that collaboration requires critical thinking on all ends, and we must ensure that the team that stems from such collaboration can effectively work in order to have these small successes daily. To achieve magnet status, hospitals must meet the 14 forces of magnetism. focusing more on 8 characteristics of an excellent work environment, which includes clinically competent nurses as well as collaborative nurse-MD relationships, according to Hooper, page 58, 2014. Through understanding our roles in a team, we are able to appropriately and safely provide care to each patient, especially because we know how to utilize one another and our resources. I am proud of our abilities, my abilities. As a team, there's no I. To respect one another and understand each other's strengths and weaknesses in order to provide the patient-centered care integral to my core values, which are an extension of my hospital's mission. With small wins each day, we can see just how important effective collaboration is. Well, thank you for allowing me to share, and I hope you enjoy my pseudo-lisp. Have a great night. Look forward to our conference call.